Hello, LinkedIn. Hope you're having a fantastic day today. Janice Thornton here with JT Fitness and Golf, your online personal trainer. And I'm here with Edward Gibbons, who is your health insurance specialist. And we have a doozy of a chapter to talk to you about today because we're reviewing the book, Never Pay the First Bill and Ways to Beat the Healthcare System and Win. So today's chapter is really about the employers and who provide health insurance for their employees. But guess what? You get to make the decisions on the prices. And we're going to talk today about how you're able to do that on a much grander scale. And then Edward has some amazing information to show us. It's actually kind of disturbing, just on different prices around here in the Phoenix area. So Edward, welcome. Glad to have you here today.
Thank you, Janice. It's good to see you again. Hello, everybody. And yeah, this chapter is the buyer sets the price. Now, in the context of this book, this is really talking about large groups and or people with the wherewithal to set up their own health insurance options and negotiate with their hospitals and negotiate with their doctors so that they can have the best pricing for the care that they need. And during the course of this, we did find some interesting information. Again, we'll share that at the end, but I'm going to show you how, as an individual, where you can look on a website of a hospital to get some ideas of what the pricing is going to be for different types of procedures. I thought that that would be helpful to people to kind of go, oh, okay, so here's the path I probably should go down when I click on the hospital's website. In this chapter, the buyer sets the price. They give us some stories about different municipalities, basically, who were being overcharged by the health insurance plans that they had. And they were trying to figure out ways to save money. The nice part about it for them is they had some industrious employees who said, I need to dig into this. Instead of just letting it pass, they decided to dig into the issue. And what they did is they got a hold of their claims data and to find out how much they were paying for individual procedures and services. And then they got into the data from the providers. How much were they charging based on the plans that they were in? So if you remember when we first started this out, Marshall Allen in his book recommends you get your codes, your payment data. What procedures were given to you? What's the CPT codes for them so that you can look them up and find out what they cost? Industrious HR managers can do the same things for their companies, identify where those costs are coming from, and that way you can streamline your healthcare so that you're not overpaying for services that you're receiving. So you want to compare what you're paying with the Medicare rates that the medical providers are accepting. Now, here's the thing that most people don't understand. Medicare is not free in the United States. People have to work 40 quarters to qualify for Medicare and have their Part A paid for, their Part A premium paid for, but they have paid for it over the course of their working life. Everyone pays their Part B premium, regardless of whether you've worked 40 hours or not. So even if you have a zero premium Medicare Advantage plan, you're paying a portion of your Part B premium each month. So Medicare is not free. People have paid into it before they actually get to that age. However, Medicare does have a good benchmark for you to look at and say, all right, if you're going to charge Medicare this price, usually a lot of companies will look at that and go, okay, the Medicare rate is X. We'll charge 10, we'll charge 15% more and accept that price as the going rate for a healthy individual who's not Medicare eligible. So that's something you can look at and think about when you're going, okay, how much should I be paying for this? And he recommends offering something higher than Medicare, but lower than what you're recently spending. Employers who don't want to try to set their own rates can try to steer employees to lower priced hospitals. And that's something we're going to show you toward the end of our conversation today. You can use the map and download data from the RAND Corporation and see healthcare systems in your state and what they're charging for most medical procedures. And like we talked last week, a lot of times you're going to find something like an X-ray, an MRI, immunizations some smaller procedures that can be done very quickly in an outpatient setting, you can probably find cheaper for cash pay than going through your health insurance company. Again, I sell health insurance plans, and there are several plans that are offered out there where prescription drugs may be a $25 copay. You can easily go use things like GoodRx and some of the other discount prescription services and get those medications cheaper than that. Okay? So there are options out there. Where your health insurance is trying to protect you is from the big catastrophic thing. You get into a major car accident, you get diagnosed with cancer, you have a heart attack. Those are things that you are going to, generally speaking, get some decent discounts at. But you still need to check your bill. You need to see what's going on. So when you're negotiating, don't blink. It's going to take some backbone to stand up to the medical industry. Okay, they've been taking your money for years without you asking or questioning anything that's going on. So when you get that bill, make sure you get the code, and don't be afraid to go into their billing department and negotiate a better price based on what you can afford and what is reasonable over Medicare rates. Any thoughts, Janice?
Well, no, I think those are all really good. Again, I just feel it, and I've said this before, we just have, like you said, we have to be brave and stand up for what we should be paying. And we are obviously so overcharged on so many different services. It's not even funny anymore. And, people are like, and we've talked about this, the system is so broken. Well, it's meant to be broken. And there has got to be some bigger plan of them trying just to destroy the healthcare system, so it makes it just unaffordable for everybody, and that's quite sad and scary at the same time. So no, I just we just have to start being more bold and stand up. And people are so willing to stand up when they're going after something else, but then when it comes to our healthcare, it's like we chicken out, going, well, they're doctors, we shouldn't challenge them, when heck yeah, we should challenge them. They're a business. It's a business. And I think people forget that healthcare is a business and they're in it to make money.
It's a business. And that's where people tend to forget. Your doctor's helping you, but the system behind them is there to make money. So you need to step up and take control. And for those who own a business and have employees that you have health benefits for, or you're in the HR department and you oversee the benefits packages, this is an area where you can educate your employees on how to consume your healthcare benefits in an effective manner. There are a lot of wellness plans out there, and people are like, oh, exercise, eat right, go to this class, go to that class. But where's the class on when you have to use the system? How do you read your billing statement?
Right.
How do you check to make sure the codes were coded properly? Those types of things are going to save you a lot more money over time, because you won't be overbilled for something. And then you may be able to even negotiate a lower price for an item.
Yeah.
There are some ideas that are presented in this book that people also need to make, they need to recognize. This book advocates taking control of your healthcare process, but it doesn't advocate that we should be able to go see anybody and everybody we want to see. The way that these plans are designed is they set up direct primary care providers for some of these group plans, which means you go see that primary care provider that your group has negotiated with for better pricing. That doesn't mean you can just go see anybody, but it means you can go see the people who have accepted that contract. Okay? But what I would call the bottom line, if we take control, like you mentioned, Janice, and we start to investigate what are we being charged, then we will have better health care, because we'll be holding the system accountable. We'll be moving ourselves into a position where we can afford it more easily because we understand what we're getting, and we don't let the system run over us and just charge anything it wants to charge because nobody's paying attention.
Yep. So I was just looking to see what their, I was looking at the little chapter summary, which
Mhm.
is always good. I think too, like you said, check the prices when it comes to your prescription drugs as well,
Mhm.
and shop around because prices are so different there as well. And a
Yeah,
lot of times your mom and pop pharmacies are going to be a lot less expensive than your big chains for sure. But shop around, and I find those mom and pop shops, pharmacies are more apt to work with you
mhm.
as well, and say, oh, we've got the discount card, let's try and see what's going to be better for you, that they're just more
Exactly.
willing to help.
Exactly. You want to
But
find someone who will be on your side and listen. And again, you
yes,
catch, you will get a better result if you act professionally and nicely to people than if you try to get in their face, be upset with them because you're frustrated or you're hurting. People are more apt to help and support you when you act in that manner.
yeah, absolutely. But I think, like you said, I think for the employers, it's just, especially if a small company,
Mhm.
and Edward, again, you take up to you like the companies who go up to about 50 people,
Yes.
correct?
Yes.
That, Edward can really help you find the right insurance that's going to be best for your company, that's going to be, um, and, listening to what he's talking about, he's going to be able to help you also really navigate and help your staff navigate the healthcare system. And to me, that's a great benefit to your employees, and just an added benefit to them knowing that, oh my gosh, we've got this guy who can really help me instead of just getting lost. And it's just a shame how much we get lost in the system. I think that's what's been fun doing these little chapter reviews right now,
Well,
figuring it out.
correct. And unfortunately, people's health tends to be the last thing they want to talk about if it's not good,
Mhm.
it's bad. Um, and then sometimes it's a little bit too late or it's a little bit frustrating. So if
Right.
you can find a good advisor who's going to be there to help you, who's going to answer some of those questions. And again, the advisor doesn't have all the answers, but they can guide you in the direction on where to ask or who to ask at your insurance company or at the facility so that you get the answers you need to take care of your family the right way. Um, but I did want to take a moment now and share my screen and kind of show you what to look for when you go to a hospital's website, so that you can find what their pricing is. And again, this was a new law that was put into effect January 1. You should be able to go to any hospital's website and see, generally speaking, what their pricing ranges are for procedures. And in most cases, you will need CPT codes, but those are easy to look up on the internet. So I'm going to go in here and share my screen. And Janice, let me know if you can see it, the banner health.
Yes, I can.
Okay. So this happens to be Banner Health, which is in Arizona. You want to be able to find where the pricing is, and they show you hospital price transparency. It's under hospital price transparency, under pricing resources, under billing. Okay? So usually it'll be under some sort of patient visitors, but look for billing and look for pricing resources. And you should be able to find the pricing structure for those plans. On this particular page, you can scroll down and they'll show you their hospitals in Arizona. And you can click on the links and go to those different pricing areas. Now, if you remember, we talked about in one of the previous chapters how pricing can be different going to different facilities.
Yep.
So I chose 3 different facilities here. Again, they're still part of Banner. This happens to be their University Medical Center, again, off of their webpage. If we looked at taking an x-ray of the middle spine, 3 views, their gross charge is around $639. Their lowest contracted rate is $34.55. Their average rate is around $298.20. Okay. Again, their gross or the highest rate at this particular facility is $639. for an X-ray of the middle spine.
So Edward, real quick though, what he did
Mhm.
was he put in there, you can see the CPT code of 72072.
Correct. They
And
put in
for
the
so yeah, so it's easy to put the code in there and then that type you had outpatient. So yeah, if you're doing an inpatient or outpatient, whatever, you can just check it. You don't have to choose payer. He has a blank. So
Yes,
you can just put in the CPT code.
correct. So this would be along that cash paying line. So you could see kind of the ranges of where this could go. Okay. Now, if we happen to go to Banner Baywood, which is a totally different hospital, same CPT code 72072. Their gross charge or main charge is 639. Their low end is 9157, so it's a little bit more expensive, but it's still less than their gross charge. And again, their max rate that they charge 639, but their average is 514. So I'm going to go back to Banner University and show you their average is 298.
Crazy.
Okay. That's Banner Baywood. But now if we go to Banner Estrella Medical Center, same CPT code, their same average gross charges, so 639, but their low end is 3506. But here's the big point. They actually have charged somebody up to $8,500 for this procedure. So I would hate to have that insurance option.
Me too.
But their average price is $215.53. Right? So again, these are all in the same hospital system, all in the same city, but there's different pricings based on that cash price offer. So I recommend you take a look and kind of get that average so you understand, what is the cost of that? I grew up in a little bit of a different time. My father was in the military. We went to a military hospital, not to civilian hospitals, and it was 35 minutes to go up to the hospital. And that's what I was just used to. That's what you do. Okay? So to me, necessarily going right down the street to a hospital is a great convenience. But if I'm going to be paying 2, 3, 4 times what it would pay at another facility, I'm probably going to skip that one and go to another one.
Right. Unless you can talk to them beforehand maybe and go, okay, I've pulled up the prices of everybody and
Correct.
you are up here and I want to pay down here. They
Mhm.
might say, well, then go to that hospital. But if it's something that you can do in advance,
Mhm.
have prices there so you can negotiate with them going, how in your own system. And that's the crazy thing. That was all within Banner Health. Why
Correct.
on earth did they not have, here's what that thoracic spine x-ray is, here's the price, period.
I completely agree
Across
with
them.
you on that. And then I'm gonna have to share with you. I found an old video. Marshall Allen actually found it of Sam Walton talking about the cost of healthcare and how
Oh,
we
really?
need to get a better handle on what those charges are.
Mhm.
And this was back in 1991 when he was talking about this.
Yeah, because I remember, because when I worked in the hospital in cardiac rehab, I remember one of our bosses coming by and she was talking about when HMOs came out in the 90s
Mhm.
and like what that was going to mean and how much money was going to actually be paid out and all that kind of stuff. And it was all freaked out because like, oh my gosh, how are things going to change? But now it's like the consumer has to pay a larger portion of a lot of things now.
Mhm.
And that's why we also need to have a bigger voice of what we're willing to pay and take a stand.
Correct. And we have to dig into it a little bit. We can't just make this a surface event where I'm hurt, I'm just going to go to the doctor and pay whatever they say. Like, yes, you're hurting, go to the doctor, pay a reasonable rate. But what a lot of
Yeah.
people ask me is, well, what is that? What's that reasonable rate? I don't know. I'm willing to pay it. Being able to go to their website and look it up like that, or being able to go to the Medicare website and look up what those costs would be. And again, we'll put those links in where you can research basically the Blue Book value of certain procedures in your area. That way you have a baseline to work off of when you go talk to the doctor. And that way you're taking the best advantage that you have. I have a recent client who they just became pregnant. So we were looking at plans for them that match the Affordable Care Act, but there are different plans out there that make it less expensive to have a baby, and other plans are more expensive, but you have to dig into it. So I was able to find them 3 plans that, if everything goes well, no major issues in the pregnancy, they shouldn't pay more than $3,500.
Oh, that's not bad.
Yep. But there are other options out there that they would pay anywhere between $6,000 to $12,000 to have a baby.
Oh my.
But it depends on the plan they pick and how they go through that process.
Yeah, it's sad when the doctors, what insurance do you have? Does your insurance cover this? Is because they're trying to come up with, are we really going to treat you, or how are we going to treat you if you don't have insurance that covers this? Then what's the plan? That's what's kind of sad is, I was thinking for that baby, hopefully everything goes great.
Yes. And the thing is, it can be kind of sad because people can go, well, I want to go to this birthing center, or I want to use this midwife. And there may be midwives who are part of a plan and those that are not. So you have to take that into consideration, what your choices are in the process. And also for your doctors, it'd be great if doctors were appointed with every single carrier, but that also puts burden on their practice and on their staff and on their process of getting reimbursed and on their process of paying their own bill. So if they find providers that work with them, provide them the time they need to see their patients and get them paid, and they can easily deal with the system, they're going to tend to go that direction. And that might not be the plan you're on. So don't always get upset with a doctor, because they're going to ask you those questions to make sure, hey, if this is out of network, you need to know that before it starts.
Right. Absolutely. Well, what else do you need anything, want to add anything else to the chapter?
One of the key takeaways I get from this book is we need to investigate what these costs are going to be. And we're giving you resources so that you know. It's not hidden. You can find information so you can make a wise decision for your family.
Very good. Well, everyone, we have one more chapter to go. That will be next week. And otherwise, if you have any questions, please let either of us know. And you can put comments wherever we post this. Please put comments below. Reach out to Edward or myself if you have any questions, or you need some insurance, call Edward. You need some personal training stuff, call me, and we will take care of you. So everyone, have a fantastic day. Bye-bye.